How to get rid of the flu. The flu is a viral infection that primarily affects your respiratory system, but it usually runs its course in about a week and does not require serious interventions. Symptoms of the flu include a fever of 100 degrees Fahrenheit or higher, chills, cough, sore throat, stuffy or runny nose, headaches, body aches, fatigue, nausea, vomiting, and/or diarrhea. Although there is no way to cure the flu, you can treat its symptoms using home remedies, take over-the-counter or prescription medicines, and take steps to avoid getting the flu in the future. Use steam. Nasal and sinus congestion are common symptoms of the flu. If you are suffering from congestion, using steam may give you some relief. The heat of the steam loosens mucus while the moisture helps to relieve dry nasal passages. Try a neti pot. The neti pot clears nasal passages by thinning and flushing the sinuses with a saline solution. The neti pot is an oblong ceramic or clay teapot that can be purchased online, in health food stores, and in some pharmacies. However, any kind of bottle or container with a thin spout can also be used. Gargle with salt water. A dry, tickly, or sore throat is a common symptom of the flu. An easy, natural way to deal with this is to gargle a salt solution. The water hydrates the throat and the antiseptic properties of the salt fight infection. Allow a mild fever to run its course. A fever is your body's way of fighting off the infection, so it is okay to let it go untreated if your temperature is less than 101 degrees Fahrenheit. It is thought that the fever will heat up your body and blood, which makes it easier for your body to fight off the infection, or that the virus may be unable to replicate as easily when your body is at a higher temperature. However, there is no evidence to suggest that taking Tylenol to bring down a fever would prevent your immune system from working at its best. You can likely take Tylenol to relieve your symptoms with no fear of additional harm, but you can always check with your doctor if you're unsure. Blow your nose as often as possible. Blowing your nose often is the best way to get excess mucus out of your sinuses and nasal passages when you are sick with the flu. Do not inhale mucus back into your nose because that can lead to sinus pressure and earaches. Taking care of yourself. Rest as much as possible. When you're sick, your body works hard to get you better. This drains all of your energy from your body, meaning you will be more tired than usual. This also means you need to rest more, since your body is working so hard. If you try doing more than you have to, you can make your flu last longer and make your symptoms worse. Keep yourself warm. Keeping your body temperature up will help speed up your recovery. Make sure that you turn on the heat in your house, so that it is warm enough for you. You can also stay warm by wearing a fuzzy robe, by staying under the covers, or by using a portable heater. Stay home. When you are sick, you need to rest. It is the only way to regain your strength and let your body recuperate. If you go into work or school while you are sick, you will be spreading your germs to those around you. Also, when you are sick with the flu, your immune system is weaker. This means you might pick up other illnesses from those around you and you could be sick longer. Drink plenty of fluids. Blowing your nose a lot and sweating due to fever and increased environmental heat causes you to lose hydration. This can worsen flu symptoms and cause more symptoms, such as headaches and a dry, irritated throat. Try to drink more fluids than average when you're sick. You can drink decaffeinated hot tea, an electrolyte solution like Pedialyte, diluted sports drinks, eat soups and water-heavy fruit and vegetables such as watermelon, tomato, cucumber, and pineapple, or drink more juice and water. Seek medical help if necessary. There is no way to cure the flu after getting it, so you will just have to ride it out. Once you have the flu, symptoms generally last 7 to 10 days. If your symptoms last more than 2 weeks, make sure that you contact your doctor. Using OTC and prescription medications. Take oral decongestants. Nasal decongestants help shrink swollen blood vessels in the nasal membranes and allow the nasal passages to open up. The 2 oral decongestants available over the counter in tablet form include phenylephrine, such as Sudafed PE, and pseudoephedrine, such as Sudafed. Use spray decongestants. You can also take over-the-counter decongestants in nasal spray form. Nasal sprays can provide immediate and effective relief from congestion, which can be administered in 1 or 2 quick squirts. Try pain relievers and fever reducer. If you have a fever and aches and pains, you can take over-the-counter medicine for relief. The main pain relievers and fever reducers are acetaminophen, such as Tylenol, or NSAIDs, which are non-steroidal anti-inflammatory drugs such as ibuprofen or naproxen. Use a cough suppressant. If you have a severe cough, try a cough suppressant. Cough suppressants include dextromethorphan and codeine, though codeine will likely need a prescription. Dextromethorphan is available as a tablet or syrup and can come in combination with an expectorant. Try an expectorant. Chest congestion is a common flu symptom. To help cure it, you can try an expectorant. Expectorants are medicines that loosen and reduce mucus in your chest. Less mucus will help you breathe better and make your coughs more productive. Many over-the-counter medications for cold and flu have expectorants in them, which can be liquid gels, or tablet form. Consider an over-the-counter multi-symptom medicine. There are countless combination over-the-counter medicines that contain a lot of these different medications. These are helpful if you experience multiple symptoms at the same time. Most contain a fever reducer and pain reliever such as acetaminophen, a decongestant, a cough suppressant, and sometimes an antihistamine to help you sleep. Ask your doctor about a prescription antiviral medication. The flu is sort of a general layman's term that is often referring to the common cold in severe form. Influenza is one specific virus, the influenza type A or B virus, that causes severe symptoms and can be life-threatening for infants and the elderly. If your doctor determines that you have influenza, he may also prescribe antiviral medications to household members for prevention, especially if they are at high risk, such as someone with a chronic disease or who is older than 65. Know the side effects of antivirals. To be effective, antiviral drugs must be started within 48 hours of becoming sick and should be taken for 5 days. However, a number of flu viruses have developed resistance to some antiviral medications. Taking these may also help contribute to other strains of the flu becoming resistant. Getting the flu vaccine. Get a flu shot. The single best way to treat any disease is to prevent it. Anyone over 6 months old should get the flu shot, which specifically targets the influenza virus. This is especially important for anyone at risk of complications from the flu and those who are in contact with those who are especially at risk. This includes those ages 65 or older, young children, women who are pregnant, those with depressed immune systems, or those with chronic health conditions like asthma or diabetes. If you are a parent or caretaker for a person with the risk factors just described, or a healthcare worker, it is important you get the flu shot too to protect these people. Try the nasal spray vaccine. Other than the flu shot, you can get the flu vaccine as a nasal spray. This could be easier for some people, but should be avoided by others. Understand the complications. There are some complications that can arise if you receive either vaccine. Be aware of the potential side effects of the vaccine. Despite all the good that flu vaccines do, there are some side effects of the flu shot. Preventing the flu. Avoid sick people. To prevent the flu, avoid coming into close contact with people who have the flu. Close contact includes coming close to the mouth, so avoid kissing or hugging those with the flu. You should also avoid an infected person if they sneeze or cough near you. Any bodily fluid can transfer the flu germs. Wash your hands frequently. Proper hand washing is the best way to prevent all kinds of infections. When you are in public or around a sick individual, you should wash your hands frequently. Carry hand sanitizer with you to use when you may not have access to a sink. According to the Center for Disease Control, proper hand washing technique is as follows. Follow a healthy diet. A healthy lifestyle can keep your immune system strong and help fight off infections. You should eat a healthy diet rich in fruits and vegetables. You should also decrease your intake of fats, especially saturated fats, as well as sugar. Stay stress-free. Practicing yoga, tai chi, or meditation can help you relax on a daily basis. If you feel stressed out, it's important for your health to take some time for yourself every day, even if it's just 10 minutes at a time. This can give your immune system that boost it needs. Exercise most days of the week. Research says that exercise may cut your risk of flu and make your flu shot more effective. Do at least 30 minutes of moderate aerobic exercise, or exercise that increases your heart rate, most days of the week. This keeps your body working in top form and helps your fight against different infections. Get enough sleep. Chronic sleep loss can have many effects, including lowering your immune system. To stay healthy, it's important you get enough sleep every night. Adults should get between 7.5 to 9 hours of sleep.